an organism, chewing its way through internal organs, devouring everything in its path. Sounds like something from a horror show, right? Well, it could be for your horse if they have parasites. Today, I will talk about the life cycle, the symptoms, and how to treat 5 common parasites in horses, including strongyles, ascarids, pinworms, botflies, and tapeworms. Strongyles are small, round-shaped worms. The strongyle life cycle begins when the eggs are passed through the feces. The eggs hatch and mature in the manure. The larva then crawls onto blades of grass to be ingested by the horse. Once ingested, the larva begins to act differently depending on which type of strongyle it is. For a small strongyle, the larva immediately penetrates the intestinal wall, and when it emerges, it usually comes in large numbers and causes severe damage to the horse and can be extremely dangerous. Large strongyles travel to the large intestine before penetrating the intestinal wall, then move to the cranial mesenteric artery. This artery is what provides blood flow to the entire intestinal tract. Large strongyles move through the artery to the small intestine, where they reproduce. Large strongyles can be extremely dangerous, as they weaken the artery wall and can cause blood clots. A horse with strongyles may show signs of colic or, in severe cases, an aneurysm. The most common treatment for strongyles is ivermectins. However, the most effective treatment for strongyles is proper manure management, as this helps eliminate the eggs that are in the manure and on the ground. That way the horse cannot ingest them. An ascarid is a larger round-shaped worm, also known as a roundworm. The ascarid life cycle begins similarly to a strongyle. The eggs are passed through the feces. The ascarid egg is very durable and can survive on the ground for up to 10 years. Eventually, the eggs are ingested by the horse. Once ingested, the eggs hatch and mature into larvae. The larvae then migrate to the liver. There, they move and eat the liver. The damage done to the liver is not permanent because the liver regenerates. However, when the ascarid larva moves to the lungs and continue to eat the organ tissue, this damage is permanent. Eventually, the larvae penetrate the lung and are coughed up and then ingested back into the intestines. The second time that the ascarids are in the intestines, they're fully mature and only there to reproduce. A horse with ascarids may show signs of trouble breathing or, in severe cases, a hemorrhage. To treat ascarids, you must use an appropriate dewormer, and the most efficient way to get rid of ascarids is proper manure management. Pinworms have the most efficient life cycle of any parasite in horses. The life cycle begins when the horse is relaxed or asleep. The female pinworm exits the horse's anus and lays her eggs on the perianal region of the horse. The eggs then either drop to the ground and are ingested or are licked off of the horse's hindquarters. The eggs then mature and grow to be adult pinworms in the colon. Fortunately, the only damage that pinworms cause a horse is the rubbing and itching of the tailhead. However, horses may also show skin irritation and the biting and itching of the hindquarters. To treat pinworms, you must first identify that your horse has pinworms. Pinworm eggs do not show up on routine fecal tests because the eggs are laid on the outside of the anus. Veterinarians commonly use the Scotch tape test. This method requires tape to be pressed in the anal region and then studied under a microscope for eggs. If a horse is diagnosed with pinworms, you must cleanse the anus and the tail and any other infected area. You must also use the appropriate dewormer. Botflies are not only annoying for you and your horse, but they can also cause problems for your horse's nutrition and well-being. The life cycle of a botfly begins when the female lays her eggs on the horse's legs, shoulder, chin, and lips. The horse then licks the eggs off of its coat and ingests them. The eggs then hatch and burrow into the stomach lining. The eggs travel through the intestinal tract and are passed out through the feces, where they burrow into the ground before maturing into adult botflies. A horse with botflies may show signs of an inflamed mouth, stomach irritation, and you may see the visible eggs on the horse's coat. To treat botflies, it is common to use fall and spring use of ivermectins. It is also necessary to use proper manure management, as this helps eliminate the botflies that are passed through the feces. You can also use a botfly knife to scrape off the eggs that you find on the coat. Tapeworms are different from other parasites because their life cycle is considered as indirect. This means that they need an intermediate host in order to develop. For most tapeworms, the intermediate host is a mite. These mites can be found in large numbers in almost any pasture. The larva begins to grow inside of the mite. The horse then ingests the mite, and the larva grows to a mature tapeworm. Mature tapeworms are found in the ileocecal region of the intestinal tract. This is the small area between the large intestine and the small intestine. Tapeworms can cause severe damage to the horse's intestinal tract and cause colic and not allow feed to pass. Tapeworms were previously considered an incidental finding in post-mortem examinations of horses. This is partially caused by the fact that they are difficult to diagnose because there are little to no symptoms, and any damage is usually subclinical and can go unnoticed for years. Also, the tapeworm eggs are hard to identify in routine fecal tests because the eggs appear in clumps and are heavier than normal eggs and sink to the bottom of the fluid that is used. To treat tapeworms, the easiest way to do this is to use appropriate dewormers. Today, we talked about how parasites travel through the horse, their symptoms, and how to treat them. The parasites we talked about included strongylus, ascarids, pinworms, botflies, and tapeworms. So, save your horse from the horror film and watch out for parasites, because they're just the bad and the ugly. Are there any questions? My sources include equimaxhorse.com, vetmed.illinois.edu, and Dr. Ken Reynolds at the Plum Creek Veterinary Clinic. Thank you.